No medicine can remove the cause of a lifestyle disease, but you can.
Namaste. I'm Dr. Jolly Thompson, Life Care Center for Reversing Lifestyle Diseases, Thyroid, Kochi. Welcome to this special New Year episode. This message is for those who wish to make a genuine decision to protect their bodies this year. It is for anyone longing to shed excess weight, reduce belly fat, and reclaim their vitality. This is for those living with chronic conditions who have been dependent on medication for years, whether it is diabetes, high blood pressure, cholesterol, or heart disease. It is for those battling allergies, asthma, or autoimmune diseases like SLE. Whether you are dealing with PCOS, thyroid issues, joint pain, acidity, digestion problems, or the daily fatigue and skin issues that have become your new normal, this is for you. This is also for cancer survivors who want to prevent recurrence and for anyone who wish to break free from the daily cycle of pills for pressure, sugar, and heart health. If you wish to avoid major surgeries like angioplasty, bypass, or knee replacement, listen closely. Should this year be just a change of date on the calendar, or should we make it the year you bring your body back to total health? Imagine the fatigue you have accepted, the glucose levels you fight, the blood pressure you fear, and the medicines you thought were for a lifetime could all be changed and you regain your health. What if this could happen gently, scientifically, and with a surprising speed? Today, we are discussing a quick fix for reclaiming health. We will explore how, regardless of how many lifestyle diseases you have, you can recover, reduce medication dependence, and avoid surgeries. 90% of the disease we see today fall under the category of lifestyle diseases. And for all of them, there is one unified solution. Let us see what it is. New Year isn't just a date change, it's an invitation. It's a chance to rethink how we live, how we treat our body, and how much freedom we want in our health. Many start with New Year resolutions, but resolutions only last if there is clarity. My goal today isn't to give you a long list of rules, but to give you direction, a clear path to move from feeling like a chronic patient to becoming an independent, healthy human being. We will see how a person with lifestyle diseases can reclaim their energy and health, independence through clinically supported lifestyle correction. If you or a loved one is living as a chronic patient, watch this fully. It might change your vision of the future. Let us start with a simple truth. Lifestyle diseases, illnesses that medicines alone cannot cure, are not just medical issues, they are lifestyle issues. Awareness must start there. The good news is that while pills cannot cure diabetes or BP, lifestyle correction can. This is scientifically proven. When you correct your lifestyle, these diseases respond rapidly. The body has an extraordinary ability to heal itself when given the right environment. In today's fast world, everyone wants a quick fix. With the clinically supported lifestyle correction, you don't have to wait for months or years. Many see changes within days or weeks. A diabetic patient can see sugar levels drop within hours. The unique advantage here is that when done with the proper clinical support, these changes happen gently, safely, and with confidence. In modern conventional medicine, we manage diseases, but we often fail to address the root cause, the lifestyle. We adjust dosages, but the patient rarely gets the support to find and fix the rhythm of their daily life. This is a gap in modern healthcare. This is where clinically supported lifestyle correction becomes vital. With the clinical supervision, we empower your immunity and your body's self-healing power to repair damaged cells and build new healthy ones. We focus on three pillars. One, nutrient balance, ensuring the body get all necessary nutrients in the optimal ratio. Two, circulation and detox, using planned, gentle physical and mental activity to stimulate cells and flush out toxins. Three, toxin reduction, minimizing toxins entering through food, water, air, cosmetics, and unnecessary medications. We have prioritized lifestyle correction in our treatment for years. Patients often come to us after trying modern medicine specialties, Ayurveda, homeopathy, etc., without success, hoping to get symptomatic relief, stop long term medications, or avoid surgery. We follow a clinically supported lifestyle correction protocol. Commonly, we see patients who are on multiple medications are able to reduce or stop most of them within a single month. To make this clear, let us quickly look at the clinical data of a few recent patients. First, we will look into a common problem, obesity. This is a 25-year-old man who's 177 centimeters height and 104 kilogram weight. And his major problem is obesity, and also he's suffering from allergy, continuous nasal block. And the ENT consultation said that he's having deviated nasal septum and advised surgery. And another problem is snoring and sleep apnea. He has also skin lesions, the acne vulgaris. Not only in the face, he's having the chest and the back also having big acne are there. And fatty liver. And his liver enzymes are also high. He's not an alcoholic, but liver enzyme also is high. It is NASH actually. GIT problems, that is gas and acidity is there, and constipation also is there. And on examination, he has multiple nutritional deficiencies like vitamin D, folate, etc., very low. And also inflammatory markers like HSCRP, it's a cardiac marker, the blood vessel marker. The obese patient with HSCRP high has a high chance for getting an attack also. And also another cardiac marker, homocysteine also high. And what was the result when we started with the clinically supported lifestyle correction? Actually, within the first month itself, he is able to reduce almost 7 kg weight. From 104 to 97, he is able to reach. And also, in the first month itself, he's able to come out of almost all the symptoms. This constipation, gastric problems, all is gone. And his sleep, he's not only sleep, apnea and other thing, he's having sleep discomfort, disturbed sleep also. That is also got corrected almost. And the nasal blocks, snoring problems, all reduced. By the 60th day, his symptoms is completely free from all the symptoms, and also the skin, acne problems also. Only thing that dark marks are not gone, but no new lesions. And after the 3 months, actually, usually we do the ultrasound scanning, repeat after 3 months. When we start, he had grade 2 fatty liver was there. And by the day 90, it has come down to grade 1 fatty liver. And by day one, then again we repeat it on day 180, that is after 6 months. By the time the liver is completely cleared. And the SGPT, SGOT, and the liver function test is cleared within 15 days itself, actually. Next is what was the overall result, actually. Before his body weight was 104, after it was 82. There's 22 kg reduction. And abdominal circumference was initially 105 and then it is reduced to 90. Next is body fat percentage. That is, initially is 38% fat was there. Ideally, gents at this age should have 10 to 15% only. The fat percentage is so high. And it was reduced to 27%, not reached ideal, but 27%, almost 11% reduction is there. Then body age, he was only 25, but his body age is 56. And by the end of the 3 to 6 months, he is able to come down to 43 years. That is almost 13 years younger the body. But he has to go further because he has to reduce the fat and build up the muscle. That is, the muscle and bone mass and the fat mass decides your body age. Next, the liver, as I said, the liver, fatty liver too, it has come down to normal at the end, and skin lesions is completely cleared, and no nasal block. You have advised a nasal surgery. Actually, this cartilage, when you do the correct exercise for the nose, it can be get corrected. Even if it's nasal, not only the is come out of allergy, that is one factor for this, and also if do the correct exercises for the nose, it, deviated nasal septum also. Some extent it can get corrected. He doesn't have any problem now, and he's managing without any nasal block, because he's not considering surgery at all at present. And snoring and sleep apnea is also good. So that is the result. Next, we will see a patient who is having bipolar disease. This is a female, and her age is 31 years and height 161 centimeters and weight 84 kg. And she is taking 5 medications, actually, lithium carbonate, oxycarbazepine, fluoxetine, risperidone, and tribexyphenidyl. For 5 tablets she is taking almost from the 2017 onwards. And she's having PCOD, fatty liver grade 2 is there, and obesity. She's 84 kg. And her complaint is she's very low energy, tiredness, always sleepy, and lack of motivation to do anything. That was her problem. And then what was the result after starting clinically supported lifestyle correction? Actually, for the psychiatric patients, this on medication, the problem with this tiredness and all is one of the reasons is the medication itself, because all these medicines are suppressing or stimulating, and there are 5 tablets. It is all interacting there also. That is the reason for her lethargy and low motivation and everything. And when we start with this clinically supported lifestyle correction, all these medicines have this dependence also. So we very slowly will try to reduce the medicines one by one, decrease the dose, and if the patient is okay, fine, then we are continuing the deprescription also. She is able to come out of all the medicines except this fluoxetine. Her depression part is more. So except the fluoxetine, we are able to come out by the 90 days. And then gradually by the 60th 6 months, she is able to come out of that also. She was advised, if she is having any stress or depression, if she is going into depression, she can take that. Or if he is having overactive, then we should consider anxiety and overactivity sort of medicines also. She was parallelly she was consulting her psychiatrist also. He also advised for the same, and because she's improving all the this thing, and she also he's with the actually from the psychiatrist support and also from this clinical support, she was able to come out of this medicine. And by the she's this lethargy and other problems is over by the second month itself. Actually, by the major medicines are over, she was able to do the exercises and all in perfect. Initially, she was very finding it difficult to do the exercises, but after it's the second month she was fine, and she started going for a job. She found out a job. By the 3 months, she started going for a job also. By the 6th month, she's now it's late for the marriage also, almost 31 years according to the Indian, our part of the country. And her marriage also is fixed, and by the 6th month. Then when we look into what was the result, her fatty liver by the 180 days, her fatty liver was gone, PCOD is gone, periods was irregular, only with the medication she was able to get the periods. After 3 months, we stopped all this hormone progesterone medication also, and she was able to get the periods without any medicine. So periods also regularized. And what was for the result for the bipolar disease? She was on 5 medicines. There's no medicine by the end of 3-4 months. And PCOS and irregular medicine and no medication for that also is stopped. Fatty liver grade 2, it was by 6 months, it is normal. And weight, she was 84 kg and it was reduced to 70 kg. That is 14 kg reduction is there, but she has to reduce another 10 kg at least. Abdominal circumference is 110 and it is come down to 92, 18 centimeter reduction. So you can imagine the figure also is changing. Body fat to 38%, it has just come down to 35%. And body age, she was only 31 years, but her body age was 55. It came down to 48. It's almost 7 years reduction is there. So that is the even for the patient with the psychiatric problems also can come out if you do the lifestyle correction in the proper way. Next, we will see a patient was suffering from diabetes, was on medication for diabetes for a long time, and dyslipidemia, that is for the cholesterol. And his current problem is his chronic liver disease, stage 4 fibrosis. That is worrying him, and that is the reason he came to me. And he has continuous right-sided abdominal pain, upper abdominal pain. That is the side of the liver actually. That is because of his liver inflammation. He is having continuous pain also. And he is suffering from migraine from the childhood itself. And he is to take a medicine and even to go to a hospital for injection and with a severe migraine, and every twice a week or something like that, he has to take at least medication tablets or even going to for the injection. So he was on medication for the diabetes and this migraine and all. And then what was the result with the clinically supported lifestyle correction? Actually, his headache is gone from the 8th day when itself he said that he is reduced, and by the 15th, after the 15th day, he got only once actually. He came on the 60th day, he said he had only when he took a food which is allergic or intolerant for him. In our part of the country, it is dalchana, that is Bengal gram, is almost 10 to 15% of the patients we see the reports showing intolerance. So he had this without remembering that he took, and the next day he got a headache, and he understood that how this headache is even related to food, and after that he's able to manage and no headache medicine. And diabetes medicine, type 2 diabetes, it is only type 2. So we start on the first day itself, diabetes medicine. So within 12 hours itself, without medicine itself, his sugar was well controlled. So he is not very fond of taking carb and all. He's very good control actually. And his acidity and abdominal pain and all is 100% reduced by the 30th day. Now almost all the symptoms is corrected. And his HbA1c actually, HbA1c was starting 8.2 was his HbA1c, and it came down gradually 7.8, 7.4, 6.6 and 5.8 by the 60th day, and 90th day it is 5.7. So that is the way. So 8.2 is with the medicine. This is without medicine. 5.7 is without medicine. That is the difference. And he had microalbuminuria, that is kidney was also CKD grade 1 was there. That is the 8th day itself it was corrected. And SGT, SGPT was high. That is also by 15th day, both the liver enzyme, all the liver function was got corrected. And the only thing, albumin was slightly high, and it came down to 4.7 only by 60th day. And the protein also, albumin and protein was high. That is because of this. This is an autoimmune, slow progressing autoimmune hepatitis. Most probably, this is the reason why his protein and albumin levels are high. That is what we observe. And what happened with the fibroscan? By the 90th day, his fibroscan report, initially it was grade 4, and it came down to 2. Fibrosis level grade 1. Reduced to 2 points actually. Next was then we overall look into here's HbA1c beginning with medicine, it was 8.2 and reduced to 5.7 without medicine by the 90th day. And fibrosis was grade 4 with this proper food and lifestyle correction. It came down to grade 2 by the 90th day, and actually by the 180th day it is liver was almost normal. Then his weight was 68 kg, came down to 62 kg. And before, his body age was 50 and came down to 44 by the end of 90 days. And abdominal circumference was 96. The abdominal belly fat was high, and it came down to 87. That is 9 centimeter reduction. Body fat percentage was initially 29, came down to 25. That is 4% reduction. And body age 59, and it came down to 44. That is 6 years younger. So that is actually, even when you do the corrections with your food and exercise, you can even, it is actually accelerated aging can be reduced. Actually, it is a anti-aging treatment itself. See, our body is made of only this food we eat, the nutrition. When we correct it, the body has immense power to repair it also. And you can become younger and you can feel it. That is the difference. You can feel the changes. Though so many medicines we are using now, there's no medicine, now energy level is increased and you are able to work properly. So that is possible for everyone if they are willing for these corrections. Next we see another patient. He is having urinary retention and prostate problem. He is suspected of a prostate malignancy, prostate cancer. And he is not diagnosed with any disease. He is not on any medicine. He is 58 years, height to 162 centimeters and weight is 68 kg. And suddenly he had a urinary retention problem and he has gone to the local hospital. They have put a urinary tube, and his PSA was high, 30 was there. So they taken biopsy and it was found to be suspicious. It's found to be of prostate cancer. And they removed initially they put after 2-3 days, they removed the tube, but again the block, and they reinserted the tube again. In that case, he was advised to undergo surgery immediately. At that stage, he came to me actually. So when we looked into more on the details, he was not diagnosed early, but his HbA1c was 6.8. He is diabetic, and also his fatty liver was there, and also his kidney function, GFR, was reduced to 69. It should be above 90. So other things, not only the urinary retention, other diseases are also there. Then what was the result? When we after starting lifestyle correction, his urinary symptoms is able to, by the 15th day, we are doubtful if you remove the tube again whether this retention will come. So we waited for 2 weeks and then removed the tube. Then after that there was no problem. There's no discomfort. We was able to pass urine comfortably. And HbA1c, it was 6.8 and it has came down to 5.7 by 30th day. And after that it was maintaining. By the 90th day it was 5.4 only. And GFR was increased by the 15th day. It is 69 initially, increased to say 82 and then 88. So microalbumin also. So all these parameters are getting corrected, and there are many nutritional deficiencies were there, and also the inflammatory markers was HSCR, PCR, PSR, and all very high. It is all corrected. Then what about the PSA? So the most worrying thing is the cancer. So the PSA was 30 initially. It gradually, the 8th day itself, it is 13.6, came down drastically. So the patient is confident it is working, our regime is working. So then it is gradually, it has come down to 12, 10, 7, 6, and 4. And finally, by the it took almost 4 months to PSA to come to touchstone normal, 3.6. So what about the ultrasound scan? Initially there was fatty liver and also prostatomegaly. Prostate enlargement was a BPH and also with the cancerous change. And the PSA was corrected. That means the cancerous change is getting corrected. And also the prostate enlargement also gone. That is common. We are treating patients with this prostate enlargement, very common. It is very common. And it is getting corrected. Even this prostate problem patients will be having sexual dysfunction also. If it is the early stage and not taken many of the medicines like testosterone and all, it will get corrected. When the size of the prostate reduces, that will get corrected. And when we look the before and after, PSA was 30 and suspected of cancer and asked for a surgery. It is no surgery. PSA got corrected. Your no urinary symptoms. Fatty liver was corrected. Renal failure, it was GFR 69. It is come down, increased to 88, but it is not came down fully normal. Next, HbA1c got corrected. Weight, he was 68 kg, slightly overweight, and it came down to 51 kg, 55 kg. So almost 13 kg reduction. Because we ask for more of a correction when we are suspecting a cancer. So that's excess fat that which is hindering the immunity has to be gone. So his fat percentage was initially 28, and the end it was 14% ideal. So 10 to 15% is the ideal. And body age, when he came, it's not accelerated aging. So 58, but his body age was 57 only when we are coming, and it came down to 37. So that is the difference. Even you can bring down your body age to 10 or 20 years. Actually, he's almost 20 years younger than what his body is. Correct. Then that is with more muscle and bone buildup and less fat. That is the secret of keeping him. Next, we will see another type of problem, that is arthritis and heart disease. This is a 66-year-old lady, 157 centimeter height and 60 kg. She's a non-rheumatic heart disease patient with a mitral valve regurgitation and stenosis. And along with it, she had suspicions of a coronary artery disease, and she had asked for an angiogram. In that stage, she came to me. She's taking antihypertensive, and for the cholesterol also, dyslipidemia is there. For both, she's on medication. And she's having kidney disease, and another major problem for her is she's having arthritis of all joints. She's saying that small joints and the big joints and the back, everywhere she's having pain also. And varicose vein also is there, and sleep problems, snoring is there. So this is the way many of the patients, not one or two disease actually, they'll be having so many problems. And hand numbness is there, leg numbness is there, it's neuropathy sort of thing, and headache, tiredness, so many symptomatic disease, and also the swelling and joint pain. Not only joint pain, the swelling is also there. So that is rheumatoid arthritis is there. Say she was on many medicines, and for the heart and cholesterol, BP, everything she was taking too many, 7 tablets on. I'm not enumerating all. It will take a lot of time if you go into detail. And actually, what was the result? Actually, for symptomatically, she's saying that the 8th day, she's sleep disturbance reduced to around 40%, and by the 30th day, she's almost sleep problem is not there. Joint pain for 8th day itself is 60% reduced. And by the 30th day, it is 80% gone. And slight sort of things will be continuing. But by the 60th day when she came, she asked me, Doctor, should I manage myself next visit, whether I should come? So that much freedom she's feeling by the 60th day. She thinks that she can manage by herself. And usually we ask for to follow up till 180 days, and then also yearly or 3 monthly, or depends on them. But actually, after by the 90th day, she is so fully happy, and she came. Not regular follow up she's doing. And neck pain, all the pain and tiredness and everything, she's by the 20th day she's fully happy. That was the result. And then when we look into the details, you can see that her major problem, the discomforts were with the joint and pain and difficulty in walking. By the end, there's no pain. Now she can climb stairs comfortably. Next, chest discomfort. This is just when she climbs the chair, steps and all, she's having chest discomfort. That's the reason for asking for the angiogram. She doesn't have any discomfort, chest discomfort, and angiography not avoided, not needed now. She's not thinking of an angiogram, undergoing an angiogram. Next, BP was taking BP medicine, and now no medicine. BP is under control. Again, cholesterol, she was on medication for cholesterol, statin was there. Now she's without any statin cholesterol is controlled. Fatty liver, she had fatty liver grade 1. Now this by 90 days, no fatty liver. And kidney failure, she is having GFR 77, just reduced, and it is increased to 93. Kidney function completely reversed. And body weight was 60 kg, it is reduced to 54. 6 kg reduction is there. And fat percentage 38 reduced to 36. And body age is 68, it is reduced to 63, 5 years younger now. So the whole body, actually in this clinically supported lifestyle correction, what we are doing is correcting the body. When we correct the body parameters, it will all the other, what is test-wise, BP, sugar, everything will get corrected. Next we will see another problem that is very common here is the varicose veins. This is a man, 65 years, 181 centimeters height and weight 99 kg. He's having diagnosed for the last 45 years, he's having varicose veins, and it is stage 6, just many times it is bleeding also. And along with that, actually varicocele, that is the scrotal veins also is encouraged and bleeding also. I had not seen many patients complain of scrotal bleeding, but he's saying that his underclothes are getting blood stain often. So he's having varicose veins bleeding from the varicocele also, and also piles bleeding, that is rectal bleeding and rectal engorgement. Actually, this is this piles and the varicocele and this leg varicose veins, all same disease. It is different places, it different manifest in a different way. That's all. And the skin of the leg is very damaged, hyperpigmentation and hypopigmentation and scarring and all is there, and recurrent attacks of bleeding also. Next, he had undergone few surgeries also for this varicose veins. His gastric problem also, nausea. Another, it's very uncommon for the male actually. He says that in the morning he's feeling nausea, and also when you travel, you feeling nauseated. And chronic liver disease, cirrhosis, actually cirrhotic form was changing, and LFT was also high. Chronic kidney disease also, GFR was low, albuminuria, urine in the albumin also, and prostatic hyperplasia. See, most of these lifestyle disease patients will be having multiple problems. Then what was the result? When we look into the result, his gastric issues was reduced substantially by the 8th day itself. Finally, by the 60th day, his gastric problems is completely solved. Discoloration on the leg was, and the discomforts on the leg was reduced, but almost 80% it was cleared. The thickening of the skin and ulceration, small ulcers and all was cleared. And the discoloration, it will take some more time for getting it corrected, and also this bulging veins will not disappear completely. It will take a long time for correcting that. Regaining that normal texture may not be possible at all. But the patient is much comfortable, and symptomatically the progress can be stopped, and some extent it can be reversed for the enclosed veins and also the skin damages. He had dizziness also. That also was almost by the 30th day. It is totally this dizziness. Those symptoms were okay. And so on. And next, what about the fatty liver and that this prostate enlargement? That also gradually increasing. It was great for prostate enlargement. It was the size was reduced. Next, when we look at the clinical, this before and after, it was his leg pain was the major problem. That is swelling and the edema and all is gone within a week itself, and by the almost all the problems is settled, and only the color changes and the big vessels were remaining by the end of 90 days. Then there was no bleeding after that. Even varicose vein or varicocele from the scrotal bleeding or the piles bleeding is completely stopped after starting treatment. And the skin color and discoloration, it is remaining somehow. Morning nausea, that is completely gone. And fatty liver and SGOT was increased, GOT, SGPT, that all come down. And kidney problems also, GFR increased to, and albuminuria gone, and GFR increased to 91. Then body weight, he was 99 kg and he reduced 20 kg, came down to 79. And I asked him to reduce another 9 kg also to keep it around 70. And body fat percentage, it was 32%, it came down to 24%. And body age, he's 71, his body age was 71, it came down to 57, almost 13 years reduction. So we are saying, I wanted to explain it what will be happen with each type of disease. That is why I have taken a different examples of different segments of patients. We'll see one more patient, he's 70 years and he's having so many problems. His hypertension, he's taking 6 medicine for the hypertension itself. And dyslipidemia, heart problems, SLE, his one's ANA was positive for his own immunosuppressant, 3 immunosuppressants actually. So I don't want to name all the medicines because it will take a lot of time. Or the immunosuppressant, he was taking mycophenolate and hydroxychloroquine and prednisolone. So all these medicines, prednisolone will increase the BP. That is why his BP is not at all under control, even with the 6 medicines. And for the BPH, he's taking 2 medicines, tamsulosin and retotrostide. And this lung problems, maybe he's having this autoimmune problem, his lung, interstitial lung disease also, or the asthmatic, and so many, almost 13, not 13, almost 16 tablets, 16 medicines and much more, 20 or 22 tablets or every day he's taking. Remember, he's 70 years old. A person who's 70-year-old taking these medicines in the correct time itself is a big trouble. And also how much gastric problems it will create, imagine. And he had a coronary artery disease and angioplasty done in 2015 or so. So this is the condition when he came. And what was the result actually? His major complaint is joint pain. He was asked for a knee replacement also. So his joint pain gradually reduced, and 30% in the 8th day, 15th day 60%, and 30th day 80%. And by the 90th day, he's almost completely clear. Only mild pain if he's walking for a long time. And breathing problem, he's saying that 8th day itself is 100% cleared, and he's not taking inhalers by the 8th day itself. And then the joint swelling and edema was on the lower limb, that is also reduced. And walking problem is completely free of walking by the 90% reduction in the 30th day itself was there. So he was taking all these medicines and he was completely out of medicine. Only thing, when he gets BP, he take 1 tablet nifedipine. That is which is most comfortable for him. So if he's increasing only the BP, he takes that once or twice a day. That's all. That itself, if it is needed, if it is traveling or some problem is there, then his GFR was 67, it was increased to 96. So even this cardiac and this ultrasound scanning is actually he had this CIMT was done because his cardiac problem, and there was atherosclerosis in the carotid arteries. That also by the 30th day it has come down. Again it is further came down by the 180th day. So, and also he has some thyroid nodules and all, it all came down actually. So then finally, before and after, when we look into, he has a major problem, symptomatically his major problem was joint pain. He's a SLE patient, ANA positive. So he was on 3 HCQ and prednisolone and MMF. So all these medicines were over by the 2 months itself, it was over. And without any medicine, he is comfortable. That is the importance of this. And BP was under control. 6 medicines, he is not able to control the BP. Now he is taking only 1 tablet if he is having higher BP or is under stress or something. And heart disease, this cardiac markers was very high. He was on blood thinners and statin. It is without any medicines, his cardiac markers is now normal. And autoimmune disease, SLE is ANA is negative now. Previously it was ANA positive. So now it is negative. So then there is no need to worry about stopping the immunosuppressants also. Next, asthma inhaler. No need for asthma inhaler now. And liver and kidney, normal test. And even the ultrasound scan shows no problem. And able to not taking any this prostate medicine. He is on 2 tablets, and both is stopped. Without that, he has no urinary symptom, and also the prostate is also size also normal. Ultrasound scan also shows the prostate is normal, and weight initially he was 79 kg. He reduced 18 kg to 61 kg. That is the importance. He is able to correct his body proportions. That is the reason for this result. And the fat percentage was initially 30%, it came down to 19%. For a age, this 70-year-old person, it is 19, less than 20 is okay, acceptable. And body age is 70 years, that was showing actually his body age was same. His body age, calendar age, and the body age was same starting, but he is able to come down to 52 years. So that difference will be in the appearance and also in his performance. So even you should, I want to took this patient also to explain, because even a 70-year-old man with so many medicines and so many diseases can come out of it. That is the important. That is why this clinically supported lifestyle correction is a quick fix. These are just brief summaries. For detailed patient experiences, you can check the case study series in the playlist on our channel. You'll see that most patients had multiple diseases, yet they recovered from all of them simultaneously. It is truly surprising. One of the most encouraging realities is that people from many different categories of illnesses are able to regain health through scientific lifestyle correction. Even more reassuring for patients is the possibility of finding relief from long-standing discomforts, freedom from medications taken for years, and avoidance of surgeries that were once considered inevitable. This brings renewed confidence and hope. Some people who come for treatment have been on medicines for many years and have even undergone multiple surgeries, yet continue to suffer without real relief. Others are those who have been advised surgery, such as angiograms, bypass surgery, pacemaker implantation, or wire replacement or heart disease, joint replacement or keyhole surgery for arthritis, thyroid or uterine surgeries, or procedures for varicose veins, piles, hernia, and similar conditions, and come hoping to avoid those operations. There are also individuals who seek this approach immediately after diagnosis, even before starting long term medications. Some come without any specific disease, aiming to reduce excess weight, improve body shape, and regain both health and appearance. Others who are extremely underweight come to gain healthy weight and improve overall well being. Couples planning a pregnancy seek lifestyle correction support to ensure the health of their future child. Couples facing infertility also come for guidance. In addition, people who have completed cancer treatment come to reduce the risk of recurrence, and others seek support as part of cancer palliative care. Those who have suffered heart attacks or strokes come to prevent recurrence and enhance recovery. In short, people facing a wide range of health challenges, as well as those who simply wish to overcome the fear of diseases running in the family, are seen to benefit from scientifically guided lifestyle correction. What we must understand from this is that the simplest way to treat lifestyle diseases is to correct lifestyle itself. Diabetes, high blood pressure, heart disease, stroke, allergies, autoimmune diseases, and even cancer all fall under the category of lifestyle diseases. Today, nearly 90% of the medicines used worldwide and about 90% of the surgeries performed are for these conditions. In other words, up to 90% of the medicines and surgeries can potentially be avoided if you follow the lifestyle approach to health. Lifestyle diseases cannot truly be reversed with medicine or surgery alone because they are not caused by a lack of medicine or operations. That is why, once medications are started, they often have to be continued indefinitely. Think of a seed, say a paddy grain, and how quickly it sprouts. When you provide water, sunlight, and protect the soil, it grows rapidly. Similarly, the human body contains stem cells, seed like cells. When you provide the right nutrition and proper blood circulation, these stem cells can replace damaged cells with new ones and help rebuild the body. This inherent ability of the body is what we harness for healing through clinically supported lifestyle correction. There's an important point that everyone must pay attention to. Before accepting advice or treatment related to health from any doctor or individual, it is essential to carefully evaluate their scientific knowledge and foundation. Where they studied, what special trainings they have undergone, and what kind of professional experience they possess. I'm Dr. Jolly Thompson. I belong to the 1981 ABBS batch from Kottayam Medical College, followed by Diploma and MD from Thiruvananthapuram Medical College. After that, underwent specialized training in reproductive medicine and surgery. Then joined government service in 1993. After resigning, started practicing in private hospitals. Since 1997, I have been practicing as a consultant at Life Care Center for reversing lifestyle diseases, Thevara, Kochi. My focus is on reversing lifestyle diseases, that is, preventing and treating lifestyle related conditions such as high blood pressure, diabetes, heart disease, allergies, arthritis, psoriasis, cancer, etc., by avoiding medication and surgeries as much as possible. Instead, using clinically supported lifestyle correction. The approach followed is SLC CAMP, clinically supported lifestyle correction with a cell activation protocol, a lifestyle correction method that I myself have developed. My clinical experience has shown that even people who have been taking medication for many years for multiple lifestyle diseases can achieve freedom from several diseases and multiple medications at the same time, often within a short period of 1 or 2 months, if they are willing to adopt scientifically supported lifestyle correction. More information about this treatment approach is available on the official Life Care Center website and in other videos on this channel. The goal is to spread awareness and understanding that the true medicine for lifestyle disease is lifestyle correction itself, not medicine or surgery. Lifestyle correction is not a punishment. If anything, it can be described as atonement, a conscious effort to correct the mistake we have knowingly or unknowingly committed against our body, guided by clear understanding. It is not about restriction, nor is it about sacrifice. It's a method, a scientific, structured approach carried out under clinical observation to give the body the right instructions. When we speak about lifestyle correction, we are not talking about a diet chart or a randomly followed exercise plan. We are talking about recalibrating daily habits, biological rhythms, sleep wake cycles, eating patterns, response to stress, emotional triggers, and metabolic functions. That is why lifestyle correction is not only possible but powerful. It creates an opportunity to achieve freedom from multiple diseases at the same time, not just one. Why is clinical guidance and clinical support necessary for lifestyle correction? Many people try to change their lifestyle on their own. Some succeed, some fail. Those who fail often end up becoming patients. They try, but then pass judgment on themselves, saying, I cannot do this, and continue living as patients. The core problem is that the human body is complex. Medications add further layers of complexity. for those who are already on medicines. As lifestyle correction begins to improve the body's functions, it becomes essential to have proper clinical guidance to safely reduce medications. Every disease and every lifestyle imbalance behaves differently in each individual. Blood sugar levels behave differently at different stages. Fatty liver behaves differently depending on the level of inflammation. Thyroid function varies according to stress. Sleep and hormonal patterns. Body weight fluctuates based on metabolism and gut health. Without scientific evaluation, people often attempt the wrong changes and then blame themselves for failing. Lifestyle correction is about doing the right thing in the right way with proper guidance. It is about making changes that suits your life and that you can realistically sustain. It is about aligning the body with its natural biological clock. It is about implementing a structured plan that works even within a busy life. And it is about understanding that your discomforts or a diseased body is not your enemy. It is waiting for your cooperation. When lifestyle correction is supported clinically, it provides scientific clarity and safety. Clinical support allows your progress to be monitored and the plan to be adjusted based on how your body responds. Most importantly, it helps identifying the right time to reduce or even stop medications, not based on hope, but on strict medical parameters. As the body begins to function better, when inflammation reduces, blood sugar stabilizes, the liver heals, and blood pressure returns to normal. You begin to understand that the body no longer needs the same doses of medication. That is the correct, scientific, and responsible way to reduce medicines. Yes, many people have achieved this not through magic and not through shortcuts, but by guiding their body in the right way, the physiological, scientific way. Families play a major role in the individual's health. A person living with a chronic illness does not live alone inside a bubble. The food environment is the family's environment. Their emotional world is shaped by the family and the workplace. Their progress or their struggle depends greatly on the support system around them. Often, the patient genuinely wants to make changes, but the family sometimes unknowingly make things harder, either by attending the patient or by not fully understanding the seriousness of the disease. In such families, the patients may feel isolated and hopeless. But when the family understand that lifestyle correction is the foundation of healing, everything becomes easier. The kitchen changes, meal timings changes, sleep pattern improves, communication becomes clearer, and not just the patient, the entire family become healthier. Awareness is the first medicine. Awareness does not mean fear. Awareness means clarity, gives you the ability to think logically. When you truly understand what fatty liver means, when you truly understand what happens in type 2 diabetes, how insulin resistance progresses silently, or how surgery adds fuels to inflammation, or medications suppress your immunity, or high insulin levels and inflammation fuels cancer, how stress leads to hormonal imbalance, and how poor sleep affects everything from mood to metabolism. Once you truly understand this, you begin to make different choices. In an era where healthcare is complex, awareness is your protection, your shield. Awareness helps you to choose when multiple treatment options are available. Without awareness, even good treatment may fail. With awareness, even simple actions becomes powerful. This time of the new year, when the mind is open up and the desire for change is alive, is the most ideal moment to begin this journey. So take time to imagine a different version of yourself. Imagine waking up without lethargy. Imagine climbing stairs without breathlessness. Imagine clothes that once felt tight, fitting comfortably again. Imagine eating without fear. Imagine stable sugar and blood pressure readings without depending on medicines. Imagine a healing liver, kidney, and heart. Imagine a calm mind. Imagine a lighter body. Imagine introducing yourself not as a diabetic, not as a blood pressure patient, not as a thyroid patient, not as a heart patient, but as someone who can confidently say, I do not have any illness that requires lifelong medication. A person who has taken responsibility for their own health. All of this is possible. It has been witnessed hundreds and thousands of times. Patients who once believed they would be on medication for life are now enjoying life without medicines. Those who thought fatigue was normal are now energetic and enjoying life. Patients with diabetes, hypertension, cholesterol issues, and obesity who were advised to undergo bypass surgery and knee replacement have reduced excess weight, avoided surgeries, normalized sugar, blood pressure, and cholesterol without medicines, are now enjoying holidays in places like Munnar, Kashmir, and Tibet. Patients who once lived in fear of complications are now confidently starting new ventures. This change is real. It begins with your decision to take responsibility for your health and your lifestyle. We must accept reality. Treatment has limits. Medicines are powerful. They can control BP, lower glucose, and save your life in an emergency. In accidents and injury, surgery is essential and life saving. Antibiotics and vaccines can treat and prevent infections and are essential. Even immunity suppressants like steroids are many a time life saving. But medicines cannot cure lifestyle diseases or change the direction of your lifestyle. They fix the test report, but they do not reverse the disease status or repair the body. They manage the crisis, but your lifestyle determines your health, your future. Medicines are not the enemy, they are a support system to keep you stable and buy time to heal while you are sick. Let us now talk about concerns regarding medicines. Many people fear the side effects of medications, yet they are also afraid that reducing medicines may not be safe. Others strongly wish to stop medicines but are afraid to even ask. Every individual and every family must understand this. Stopping medicines suddenly is not correct and is unscientific. However, when lifestyle correction is implemented and it is clearly confirmed through tests that blood pressure, blood sugar, and cholesterol are coming down on their own, medicines can be reduced gradually and responsibly with clinical support. Even after stopping medicines, regular testing must continue to ensure that the levels do not rise again. Every body is different. Let the doctor and the clinical team evaluate. Let laboratory data guide decisions. When done the right way, reducing medicines and gaining freedom from disease becomes a celebration. May this new year becomes a season for celebrating your progress in health. This year, I'm not responding to the disease. This year, I am responding to my body. Being able to say that one sentence can change everything. When we choose to respond, we begin to make conscious, mindful decisions. We respond to our body with respect. We choose food not merely for taste, but for nourishment and protection of the body. We find time for rest and sleep, giving the body what it needs to recover. We move our bodies to honor life itself. We exercise. We understand our measurements, our weight, our waist circumference. We undergo tests at the right time. We ask questions. We seek clarity. Instead of waiting for complications such as a heart attack stroke, or cancer to appear, we take early actions. This mindset makes lifestyle disease reversal faster and more practical. Yes, you can come out of diseases and medications. You must learn to say yes to yourself. You must understand your vulnerabilities. This is not a battle, it's a partnership between you and your body. May this year becomes a turning point where you decide that you deserve better health, not average health, not survival based health, but thriving health. Health that allows you to travel freely, play with your children, care for your family, work with confidence, live without fear, and age with dignity. To everyone listening, whether you are a patient or a family member, remember this: when the right steps are taken, lifestyle diseases can be reversed or significantly improved. Lifestyle diseases are not a life sentence. If you're willing to correct the daily mistakes you make towards your body, freedom from lifestyle diseases is possible. Diabetes, blood pressure, and cholesterol do not allow them, and the medications destroy your organs, the heart, kidney, liver, eyes, etc. If you are ready to correct what you do wrong to your body before damage begins, or at least before damage progresses to dangerous levels, you can free yourself from lifestyle diseases, from the medications taken for them, and even from surgeries, and go on to enjoy life in good health. When you guide your body with a proper understanding of its biology, the body begins to heal. So, as you welcome the new year, silently repeat this to yourself: I am not just a patient who must live in fear every day, taking medicines and worrying about heart attacks, strokes, cancer, pain, and the complications of diabetes and lifestyle associated diseases. I am a human being capable of healing. I will not live passively. I will take responsibility for my health. I will correct my lifestyle. Whisper to yourself: I will respect my body. I will lead my family towards a healthier future. A new year does not change your life, you change your life. But sometimes a single decision, a moment of clarity, a spark of awareness is enough for your entire health journey to begin moving in a new direction. I wish you a new year filled with clarity, strength, and renewed hope. You deserve a life guided by awareness, not ruled by disease. We experience life through this body. Therefore, remember this truth: understanding the body scientifically and caring for it is the very foundation of living life itself. If what you heard today touched you, even at the corner of your heart, if a quiet thought arose within you saying, maybe I can do this, maybe I can heal, maybe I can avoid medications, maybe I can avoid surgery, then rejoice. The door to health has opened for you. This new year, give yourself the gift of awareness about health, and also gift a healthier version of yourself to your family and to society. Begin to observe your lifestyle. Start understanding your body's measurements. Make new and different choices when it comes to health. If you feel confused, stressed, or unsure about where to begin, seek support. Clinical guidance is not a sign of weakness, it's a sign of wisdom. You do not have to make these decisions alone. Share this video with your parents, family members, and friends. Subscribe for more scientifically supported health guidance. If you would like detailed explanation on specific diseases in future videos, please leave your suggestions in the comments. May this new year become the year in which you step out of the identity of a chronic patient, someone living with an incurable disease, and step into the identity of a confident, independent, healthy human being, not dependent on chronic medication for survival. May this truly be your year of change. Thank you.
The informed patient is key to treatment success.